Sorry for the interruption. The internet connection was lost as I was finishing up here. So I just want to circle back around and just recap our lessons learned that Jackie shared. So again, those patient subjective complaints cannot be ignored even if they seem normal until they are objectively evaluated. So as I was saying earlier, if a patient is, if we're talking to them over the phone, it can be hard for us to really gauge the level of pain that they're actually in. This gentleman was unable to tolerate his leg being touched, his skin being touched. He was hallucinating because of the pain and because of the pain meds that he was on. And then in general, his exam was alarming as it related to the physical examination aspect. So if it doesn't pass the sniff test, then really continue to dig into it. So if something just doesn't feel right, don't stop there just because you've been told to expect that this could be common. If that's, that was the case here. In this case, Jackie really felt like something was wrong. So she was confident in speaking with the physician, even when something didn't seem right and it didn't seem that it was adding up in regards to what she was being told to expect. And the last thing that she recognized is to think that DVT is not the only thing that we need to, maybe not necessarily worry about, but be concerned about post-surgical if a patient's coming in presenting with similar symptoms. So we want to keep that in mind. Again, she acted as quickly as possible. Unfortunately, I believe that this patient's surgery occurred on a Thursday, and they stayed in the hospital overnight Friday, and then they were discharged home, and then they were at home over the weekend, and that's whenever these symptoms had begun. And unfortunately, the patient wasn't seen that Monday. So from a time frame standpoint, we did lose a little bit of time in the fact that the patient wasn't seen by anyone or evaluated by anyone until Tuesday. So just from a patient perspective, remember to always advocate for yourself if something doesn't seem right to you. And then from a therapist perspective, remember to advocate for your patient if something also doesn't seem to add up as well in their care. And that concludes the content for screening in special populations. So take a moment to pause and review the content that was covered and outline any questions that you have or any topics that were unclear that we can cover in our Q&A this week.